Today I'm going to look at the lifestyle ways of managing hypertension. So healthy lifestyles can avoid or delay or reduce the need for medication in hypertension. Some of the ways that you can put into practice in your lifestyle include: one, losing the extra weight. As we know that if you are obese, then you need to bring your BMI to the normal. The normal BMI for adults is between 18.5 and 25. The way you calculate your BMI is your weight divided by your height in meters squared. So that's how you get to know your BMI. And also, apart from losing weight, also we looking at your waistline. So we should also work on your trunk obesity, because that's where most of the abnormal fats are stored. And for men, we expect that your waistline should be less than 102 centimeters, and for women it should be less than 89 centimeters. The other way that you can reduce hypertension and reduce the need for drugs is regular exercises. Regular exercise, we are talking more generally of aerobic exercises, which should be more than 30 minutes, at least for 5 days in a week. And this should be consistent. And when we are talking about aerobic exercises, we are talking about walking, jogging, cycling, swimming, and also things like dancing. And you can also incorporate 2 days of strength training exercises. I would also encourage, especially our children, also we encourage that they have at least an hour of active exercises in a day. So even children, we need to encourage them to exercise, because what children learn when they are young, they will be able to maintain it even when they are old. So let's encourage even children to keep an exercise program. Then the other thing that you can do is maintaining a healthy diet. A healthy diet will include a diet that is rich in fruits, vegetables, low in fat, and there is also what is called the DASH diet. The DASH diet stands for dietary approaches to stop hypertension, and its main component is that a quarter of your diet should be of vegetables, another quarter should be fruits, then you have like a third comprising of whole grains, and then proteins. The proteins could be meats, and if it's meat, it's lean meat and or white meat, and also grains as source of proteins. Then the other lifestyle modification that one needs to work on is reduction on the salt intake. Usually we encourage that your total salt intake in a day should be less than 1.5 grams in a day. The salt we use in cooking might not be a big culprit, but the salt we use at the table, that additional salt, makes us retain water, raising our blood pressure. So we should be careful. Then also there are some foods that are known to be highly salted, especially the packaged foods. We are talking about tinned foods, canned foods, foods in the ones that are sold with paper bags in supermarkets, and anything also in a box. We should be very worried about that. So eat less of the processed food, because those are the ones that have high salt additions. Then those who take alcohol, limit the amount of alcohol. For men, we talk about 2 drinks at most. For ladies, we are talking about 1 drink at most. And you are talking about a normal beer of 350 mils. If you are talking a glass of wine, it should not be more than 150 mils. And if you are talking about spirit, it should not be more than 45 mils. Then for those who are smokers, it's very good for you to quit smoking. There are different ways of quitting smoking. There needs to be counseling. There are also drugs that can help you to stop taking can help you quit smoking. Then reduction of stress. So sometimes you may look at what are the things that are stressors in your life, and then you can change your expectations, and also try to find ways of dealing with stress, because as far as a matter of fact, stress is part and parcel of our lives. Then it is always good to monitor your blood pressure, either in the health facility, or we have home monitoring of blood pressure, and this consistent monitoring of our blood pressure will help you know where you are and when to make adjustments. Then also gain support and work as a group with your healthcare providers, with your family members, because as you see, many of the things that we have talked about, if you practice them together as a group of people in a family, eating health as a family, exercising together as a family, then it makes it easier. So overall, these lifestyle modifications are lifelong. We all need to adopt them. Those who have hypertension, those who have no hypertension, because they are healthy lifestyles and they will improve our health. And also we encourage even our children also to adopt these healthy diets, exercising for the sake of their health. So for you to maintain a healthy lifestyle and these lifestyle behaviors, you need a lot of motivation. It needs commitment, and it needs also you to be positive. You look at what are the positive gains that you get from living a healthy lifestyle, and this will help you to improve your health and avoid most of these lifestyle related diseases. Thank you very much.